Here we go. Welcome, everyone. My name is Allison Schumacher. I am the Director of Academic Alchemy for the VCU da Vinci Center and co-director of this program, the Graduate Certificate in Healthcare Innovation. Got to say that correctly. And my co-director is with me, Ingrid. Would you like to introduce yourself?
Hi, I'm Ingrid Pretzer-Aboff. I'm an associate professor at the School of Nursing here at VCU. I'm a senior nurse researcher, and I live in the space of medical devices presently in my research in working with Parkinson's patients. So for the intended purposes of the certificate program, I bring to you a lot of experience with healthcare products and where to go to get answers, and how to learn about the process, which is for nurses, we have a lot of great ideas of how to help patients, processes, products, etc. For engineers and for other people outside the healthcare system, our healthcare courses are designed to help you understand the healthcare system so you can interface with them a lot more easily. I'm the co-director, as Allison said, of the certificate program as well.
Excellent.
Welcome. Stop us at any time to ask questions.
Yes, absolutely. Feel free to interrupt us. Raise your virtual hand. I guess we can do that in Zoom, or just speak up or pop things into the chat. And for all those who may be viewing this recording, know that our email addresses are at the end of on the last slide of this, and you are absolutely welcome to reach out to Ingrid or I at any time. Questions you may have. So I'm going to share my screen. Here we go. Everybody see that first slide?
Yes.
Okay, great. Thank you. All right. So looking at, let's see, let's get on my right screen here. Always the things, right? Are we on the right place here? So just as an introduction to this program, Ingrid did a great job of explaining how we're trying to bring people from the healthcare field who see problems in healthcare every day, and people who want to develop products and solutions for healthcare, but need to really understand the protocol and the safety and how health systems work and how you might actually get something implemented. And with that, we started this program. It launched in fall of 2022. So we have plenty of examples of how in the Master Product Innovation Program through the Da Vinci Center, how we've successfully developed some healthcare products and how we're working with current students in this program in that direction. But this stuff takes kind of a while to find those successful things. So we're trying to give that confidence, that introduction to these different topics so that our students are able to go out and kind of pursue these things themselves. On top of that, we don't disappear when people graduate. So we can continue in that process and help connect to our networks and offer a few resources while you're in the program. So those resources are listed here. We actually today, if you are willing and you would like to send us your email address, I can loop you into a speaker that we're having in today. So we are having the CEO and co-founder of Case Control come in. This is a medical startup that went through Lighthouse Labs, which is a top 25 accelerator located right here in Richmond, Virginia. And that is part of our networking and speaker events that we see listed here on this slide. So we have a few speakers, mostly people coming in from the healthcare side or who are running healthcare startups, in order to talk to our students about their journey and how they got to where they are and the troubles they saw along the way, to kind of give an insight into what that world actually looks like. So part of that, we will do a bit of an orientation for our new students who have been admitted to the program afterwards. And then on October 26th, we will have another from the CEO and founder of Nestle, which is another medical startup. And that will be happening, what is the 25th of October, I believe, as just part of the support. And in this, we list these resources and have all kinds of links and that kind of stuff and introductions to the other students in the program, since some people will attend this program fully online, will never make it to Richmond in person to meet people. We like to host networking events. So after that October 25th event, we're going to bring a give time for all of those students to be able to hop into conversations with each other and start to build that community within these two very different groups of people, or I guess it's probably more like a Venn diagram of people, but have a very common interest, but to meet people who have skills that are different than their own. We also offer the Adobe Creative Suite for every student who is part of VCU now. It used to be part of our program, but now it is part of VCU. We are one of 30 official Adobe Creative campuses, and we'll be having some events through Da Vinci about Adobe Week this 2 weeks, which is pretty exciting. And so feel free, if you're in town, come by the Shift Retail Lab. We will be happy. We're going to host a watch event and some co-working time, and happy to meet any of you if you would like to come by. Also, any of our events can usually be seen on the VCU School of Nursing or the VCU da Vinci Center's websites. There are event pages. Those are open to anyone. Feel free to sign up and sign up for our weekly newsletter and stuff too, so you can kind of see what's happening in the Richmond community and also what's happening at VCU in terms of like innovation and entrepreneurship and working with industry. All right, getting into spaces, some other resources we have here. We have a full-on makerspace. I can't say that it's as exciting as maybe the 10,000 square foot makerspaces we see over in the College of Engineering. But any student who is part of Da Vinci also has access to those spaces as well. But here we have 3D printers, laser cutters, vacuum form machines, sewing machines, a whole load of hand tools, and all the materials that are in the shop are provided free to any student there. So when you sign up, you automatically get added to our key card, and you can get into 807 South Cathedral Place, where this is 24 hours a day, which is pretty cool. We also have the VCU Innovate building, where the first floor belongs to Da Vinci. Most of it is just kind of our standard classrooms and conference spaces, as you can see there in like the third picture from the right. But in that second picture there is an awfully plain version of what our Shift Retail Lab space is. So this is a space for anyone who has a product idea to come in, get feedback from the community. You can actually display and sell products if you have a product that is at that level, and you maintain 100% of the funds that you earn through those sales. We pay to keep the doors open, make sure that we have students who are there to help provide information about your products if you're not there, and help with the sales, but it's all done through QR codes that go straight to your Cash App or Venmo account. So we don't touch.
Allison, do you want to advance the slide?
Oh, shoot, I'm sorry. I advanced it on the wrong screen. Thank you for interrupting me. Here we go. Okay, so the first one being 807 here. The second one being Shift Retail Lab. This one actually just won a Fast Company award for a world-changing idea. We got a honorable mention in that for urban design, which is pretty exciting. Then we have our standard classroom spaces, and then we have these great communal spaces that are located in the School of Nursing. For any students who are part of the certificate, definitely can connect with other students there, can connect with other master students in the leadership program, which is the partnered program to the MPI. So yeah, lots of resources available to our students. All right, Ingrid.
Okay, it's advanced. I'm sorry. Okay, we have deadlines to this application. And the next deadline for January start would be November 1st. But we have a rolling admission pretty much all year for the certificate program for both the master's degree in leadership for nursing, and also for the MPI program. Those are not rolling admissions, but in terms of this certificate, it is, and both of the courses that are required for both sides are from these original master's degree programs. So you're not wasting any time by joining in the spring and or summer. It kind of works out really well in hand step. So what you need is, next slide, part-time program. If you'd like to take this as a part-time program, that's fine. It takes 1 to 2 years to complete. Nursing courses are offered online. They are asynchronous, but they're very much interactive, so don't think it's a passive course. Da Vinci offers online courses, and so students can complete the program fully online, provided that course happens to be online. Some of the Da Vinci courses are scheduled after 5 o'clock to accommodate working professionals, and that would be a face-to-face courses on campus. Like I said, the spring deadline is November 1st, and you can apply, or you should apply through the graduate school. A total of 12 credits are needed to graduate, 6 from the VCU School of Nursing leadership program, and also 6 from the Da Vinci side. You can take more than 6 credits on either side.
I have two.
Again, some of the Da Vinci courses may not be offered online. It depends how many people are enrolled in the course. Next slide.
I have 2 points I want to add to that, just because we know what goes on in the background, but want to provide clarification for our audience here. The nursing course is being offered fully online and asynchronous. Doesn't mean that you're just completing the class on your own. There very much are group projects and engagement outside of class. It just allows for you to engage with the content when you have time throughout the day, but there's very much a schedule that happens within the class, and a bit more traditionally focused academics in the nursing classes versus applying what you're learning in the MPI program.
They're also no, Allison, they're also very much applied projects throughout the master's program. I think this entire master's, both degrees and the certificate program, are extremely hands-on.
Oh, yes. Sorry,
so it's interactive. It's interactive, it's hands-on, it's constant movement. Not just a lecture sitting in front of your computer.
The clarification I was trying to make there is that we don't take tests in Da Vinci, but there are tests in the school.
Very possibly there are tests in the School of Nursing, absolutely.
Yeah. And then the other part of this was, oh darn it, now I lost my train of thought there.
You'll get back to it.
Yeah, I'll get back to it. Okay, we'll keep moving, and I'm sure it will get.
It'll come back to you.
Slide. It always does. All right. Oops. There we go.
I have to move my little cursor there. Okay. The requirements at a glance: you need a bachelor's degree from an accredited college or university. Tongue in cheek, we say a GPA of 3.0 or higher. There are exceptions that are made based on a holistic review of each applicant. GREs and GNETs and MCATs are not required for this program. If you are a non-native English speaker and you have not previously been awarded an undergrad degree taught in English from a university or college in the United States, we need you to provide evidence of proficiency in English by one of the 3 tests. The TOEFL of 100 or higher, the IELTS of 6.5 or higher, or passing score in the VCU English Language Program Comprehensive Test. Those are required. There's, as I said before, there's 6 credits from each program. The VCU School of Nursing program, on the left side, there's 3 courses to choose from. You need 2 of the 3. And 1 is offered in each, they're different, and it's offered in the spring, summer, and fall. So it might have to do with what's available to you and your schedule. Nursing 517, Nursing 517 is a course called Organizational Science for Human and Material Resource Management. It extends the use of science-based organizational theory. You compare individual and group behaviors and high and low end performing teams. It really looks into the team aspect. You complete a job analysis, position description might be one of the projects that you work on. It's very applicational. So if you're working in that field of leadership, then these are some of the things that you'll be running into and understand. And it also translates supply chain and logistics to unit-based material resource management. So you understand the supply chain within the system. Course 603 is an improvement science and outcome management course, which I believe everybody should be taking. It's emphasis on quality and safety science. And that's what this program is all about. Identify needs of the person, the process, of the patient, or whatever needs are there. Identifying them, analyzing root cause analysis. Usually a need is produced by something that has gone wrong. And that's why learning how to do a root cause analysis is vital. Coming up with a possible solution, and if that solution is viable, then bringing that solution all the way to possibly commercialization, or at least mass production and use. And course 515 is a holistic leadership. This course itself is very interesting. It looks more at your own values and your own value personal profile, reflects political, legal, ethical, diversity, and cultural perspectives in terms of leadership in healthcare. So that's also a really interesting course. If you want to understand the healthcare system, I suggest taking that one as well. And then there's a lot of courses that you could take in this ever creative space of Da Vinci Center. They're constantly coming up with new courses and improving old courses and holding on to really successful courses. So I'm going to pass the torch over to
Yes, and
Allison now.
I will try not to long talk too much on these. So we do offer quite a few courses that we see as compatible with the certificate. Many of these are elective courses that are open to our Master of Product Innovation students, and some of them are required in the Master of Product Innovation program. So just kind of going down the list here, the ones that are available in the spring, we have, they're probably going to be more than this under the numbers of like 591s or 691s that we may offer, mostly because we have faculty who are looking for gaps in what students are interested in, and then proposing these topics courses as a method for solution there. So I know this doesn't necessarily relate to healthcare, but I know we're most likely going to be launching one in sustainable energy technology. We have the director of innovation for Dominion Energy teaching in our program now, and he's interested in teaching a 1-credit course come spring looking at sustainable energy. So just as a glimpse into what you might see hit the calendar soon. But
that very much applies to healthcare. Just so you know, we had a whole lecture on that. And the crisscross for the environment very much impacts healthcare and what we do as healthcare providers.
I mean, you can tell here. You can tell here that Ingrid's the expert in healthcare here, and I am certainly not. But any of our 691 courses are currently available for anyone in this program to take. And like Ingrid said, you can take more than 6 credits in the program. That is completely up to you. So looking at the start here, we have in 0610, this course is open to any graduate level student or professional level student across campus. It's taught by someone who uses design thinking in real life. And design thinking is the foundation of everything we do in the Da Vinci Center. So starting with empathy and user feedback and understanding what the user's problems are before trying to create solutions to make sure that we are fulfilling that need. So this course really gets into innovation, design thinking, change management, which is a great crossover with the healthcare side of things. And you receive, I believe it's 2 to 3 internationally recognized certifications in design thinking through this course. But everything we teach in the Da Vinci Center, just like in the School of Nursing, is by people who do this stuff. This is, you know, we tend to recruit more people who work in industry and run their own businesses and who actually are practicing this stuff every day, more so than we have like full-time people who are only doing academics and research. Then looking at 651, this one is really special. And so this one, this is a 6-credit course, so it can take care of all of your credits for the certificate in just one round. And it's mainly reserved for students who already have a product in mind and are looking to validate that idea and really do research and work it towards commercialization. So we've had Alison Monpetit, who anyone who might be working in our healthcare system here at VCU would happily know her. She runs all kinds of things for nursing in our hospital. But she took this course really looking to develop an information sharing platform for clinical research, which is just incredible. And she's continuing that process even through all of the crazy that we've seen come into our healthcare systems in the pandemic. But this one requires students to apply either in end of or beginning of December, where you're submitting an abstract with your idea to be reviewed by the graduate committee, or it can happen at the very beginning of January. But we just need to take a look at it, make sure it's something that you can actually make progress on in a 15-week semester, and then it can apply to that it's further enough along in the process of I guess conception that we can help you with it move through that particular course. Then, like I said, there will be other electives that will be both on our website and listed under the NO prefix when you go to register. And then looking ahead to summer, There are plenty of electives that I'm going to describe on the next slide, and they may change a little bit from now until summer, but generally we have a really good cadence with those specific courses. But the one that I think is probably the most experiential in this is INNO 600, the Integrative Design Studio. This is where we take students to the European Innovation Academy for 3 weeks. This is, we provide the housing for students in this program. We provide both the ticket to EIA and housing for Master of Product Innovation students. But this is a 3-week process where you go from idea to startup in just that short period of time. So from idea to pitching to venture capitalists by the end. It is meant to be the fire hose effect of all things product development and entrepreneurship, and has a pretty diverse audience that goes into it in terms of age and experience and all kinds of things. There are, freshmen in college all the way up through PhDs, and then independent people who come from industry who just want to have this experience. So it's an incredible opportunity. And this next year we will be in Portugal for that experience. So if you can imagine being in Portugal for 3 weeks and being able to learn basically the whole cycle of what it means for a startup to enter the world, really fantastic experience. Many of our other classes give the depth. That's really one that is more on the breadth of things. We also offer 610 in the summer and in the fall. So already spoken about that one. And I'll get into the summer topics courses a little bit on the next slide. In the fall, this is probably one of the most, the first one listed here, INNO 502, Business Principles for Product Innovation, is probably one of the most popular courses for our folks coming from healthcare. It really looks at business through the lens of product, of innovation, really looking, how do you make the argument to the right stakeholders in order to either get investment for you to build out a product, or for you to make a compelling argument to the your current job and trying to get something to move forward. So whether that's changing a process or a service or something like that. So there are really great opportunities to understand how to make those arguments, and really understanding the number side of things. How do you show what you want to do will make an impact. And you get some pretty great experience in terms of engagement with Master of Product Innovation students there as well. And then the last one listed here, it says with permission, because I've already talked a little bit about the other two. So 590 is a course that I teach. And this is one where if I know I'm bringing healthcare students into that course, I will actively seek out projects in healthcare. So this is where we're working with the Pfizers, the CarMaxes, the Capital Ones, the nonprofits, startups. We have Nestle, who right now is working on a project within our program. We also have one for the VCU Dental School, working on creating a physical product there for dental board testing. So this is something I say with permission, because I work more than a year in advance to start collecting these opportunities, these product opportunities or problems for our students to work on. And it very much is a real life thing. This is meant to develop several solutions that will be put into market by the sponsor that comes in. It is not just a practice round. It is you're learning while you're doing at the same time. But welcome students to come into that. So if maybe you're thinking about applying now and would like to join that class in the future, you can just shoot me an email and let me know. I just got to know more about you. And if I just had students randomly signing up for this class, I may need, 6 more projects than I already have. So we restricted that one just a little bit. Okay, so next slide here is just getting into a little bit of those electives I talked about for summer. So Eric, this might be super pertinent to you as someone who may be taking these in the summer. In the summer, we own that 610 class is only 8 weeks as opposed to the full semester. And then these other 691 courses that we have here. So user experience, user interface. That can be everything from the experience that a patient has from the time a care provider enters the room to the time that they are discharged. It could be an application, it could be a website, it could be a lot of things, but basically it's looking at the process of the user journey and their experience from touch point to touch point. And so if you're working to improve a process, you could very much use the theories expressed in this class to do that. Usually this class is only 2.5 weeks. Sometimes it's only 1 week, but those classes are about usually 4 hours a piece if it's only it's only 1 week to get a graduate credit. Usually you have to spend a good portion of your evening, maybe from like 5 to 9 p.m. In those courses, but you really get the breadth of knowledge there and can understand some topics on a deeper level. So we also do intellectual property for startups. This is an incredible course, and I will highly recommend it to any person who is interested in understanding more about patents, trademarks, copyrights. And while that may sound somewhat boring, this is one of the most entertaining faculty I think I've ever had come into this program. His name is Lu. He is a partner at Nixon Peabody, and he's absolutely incredible human being. He provides real world experiences, real cases that are coming from his firm for the students to assist on, to be able to help see things that maybe the lawyers aren't seeing. So understanding how litigation goes. So if you have someone who violates a patent that you have or a trademark that you have registered, what does that look like when it comes down to the court, and how that's argued, and how we really, look into the law behind that. The students did 3 projects in that course this past summer and absolutely loved it. Highly recommend. Other ones we offer, Scrum. Scrum is a project methodology. It is a method of being able to help teams be really successful and really productive. I know Ingrid and I have both gone through Scrum Master training. I've also gone through the Scrum Product Owner training. We started offering that at the beginning of our summers in Da Vinci. It connects very well to design thinking, and those concepts really cross over. You see a lot of the product development process within that, and then that is also an internationally recognized certification. That one does involve a test, but it's not our test. That's the Scrum Alliance test. But the course is taught to the test.
It's not difficult. The test is not difficult, and I enjoyed it taking it as a nurse because there's language differences in both buckets in the world of innovation and the world of health science. And while a lot of the concepts are very familiar, the wording is not. So it's like a translation, and it helps team building and teams progress through a project. And where you get stuck, it's very helpful.
Yes.
The other where you work.
the other 2 here, I've added as you may not find a direct correlation from the healthcare side of things as you may hear in the other I've provided. But in terms of working on the Shift Retail Lab branding, we worked on Shift. The actual branding was created by the Brand Center, but we've now realized that our students are very interested in doing food products. So we're looking to open a Shift Cafe. Actually building out a cafe space and giving students the opportunity to use that space to prototype and create new products and potentially also serve the community as well. So with that, we've been asked to potentially do a research lab in the medical space as well. So what does that look like as a entire brand as opposed to just one particular location? This is something we were running last summer and may continue in the future. So this one may or may not be on the summer schedule. And then the 591 that we see there, 591 distinction there is that it can be taken by undergrads or graduate students. So you're combined, which is really great. We have some really high performing undergrads that join these classes. And Designing Your Life is taught by our Associate Director for Student Success, Mary Chris Escobar. And she's very much into mindful teaching. She does that as part of our events, Mindful Mornings. And this is applying the design thinking process to your own life and your goals and what you want to accomplish. So I definitely see this one being helpful in terms of people who are maybe trying to find their path, know that they have interest in either product innovation or the healthcare space, but do not know which direction to go. This is an excellent course. And that one is generally offered in the fall and the spring semesters. And we may see Mary Chris decide to offer it in the summer as well, but we will
Allison,
see. Yeah.
Which one of these courses did you say was applicable to the cafe?
Oh, the Shift Retail branding.
So there's a lot of work now being in the community in the health sciences field that feeding people that don't have access to food and trying different things. So that might be a space that they would be able to try something.
Yeah, absolutely.
We have a process. So there's a lot of our imaginations could go wild with all of these things. So I'm just
absolutely. There is space in there for
Yeah.
health and health equity and all of that.
Exactly.
Soon,
That's awesome.
hopefully we will get our approval to build out that space.
And if you want to know more about all of this, we have on the bottom of the slide is the Da Vinci set of programs and classes. So that'll give you the most updated descriptions.
Absolutely. All right. Okay, so looking at tuition costs, this is kind of odd to describe, but this is, I guess, how it works in universities. So if you are only enrolling in the graduate certificate in healthcare innovation, you are a School of Nursing student, technically behind the scenes, even though this is a shared program, and you pay standard in-state or out-of-state tuition, depending on which one applies to you. If you are a Master of Product Innovation student and taking the certificate, you don't pay anything beyond the tuition you would for our master's program, because the nursing courses fit nicely into the elective credits for the 6 elective credits that you need for the Master of Product Innovation program. And if you are part of a master's program in another school or college within VCU, then your tuition comes, that rate is set by that master's program. So if it's the normal standard rate, you're going to pay the normal standard rate. If it's elevated, then you will pay that amount per credit hour. That is just how it balances out in the university. And you can also see how fees and tuition apply to you by checking out the tuition calculator under the accounting VCU accounting website. I can also help answer some questions there, but we are kind of limited in what we can talk about in terms of finance, and also financial aid advisors can be helpful with that as well. All right. I think this one is yours, Ingrid.
Oh, no.
Oh, no, it's mine. Oh my goodness. Okay. How many times have we done this? And I'm not remembering this.
That's okay. It's very complex, the financial aid atmosphere. I can tell you that nursing has just recently gotten a $13 million donation for students. So definitely look at the School of Nursing site to see what different scholarships are available for you.
Yeah, that's an incredible thing we need to celebrate. That's a lot of money in support of students. One day we will get this through Da Vinci. One day I want all the tuition to be free, but that's kind of an ambitious.
I know.
So looking at the School of Nursing, since this is a part-time program, there are fewer scholarships that tend to be offered for part-time students, which can make it a little tough, but there are also jobs and those kinds of things available on various VCU websites. I think it's called Hire Rams. So in the event you are enrolled and you want to be able to work for the university or their partners, you can also look for positions there to help support. If you're an employee of VCU, you can use tuition support for this program. So the School of Nursing is working on some scholarships. The Da Vinci Center always offers up scholarships and fellowships available to our students, but mainly to our Master of Product Innovation students. Again, those who are enrolled full-time tend to take precedence in that kind of space or that kind of funding. But graduate students know that if you've never taken a graduate program before or anything like that, it's very different in terms of financial aid than an undergraduate program. In that, if you're applying to graduate program and you may be just out of undergrad, your parents' income no longer applies to your financial aid. And you only have to be enrolled in 5 credits in order to access federal funding. You do not have to be a full-time, which would be 9 credits as a graduate student in order to receive federal funding. And if you'd like to take out personal loans, Elm Select is a good resource and one that VCU recommends. Also, the VCU, there are graduate assistantships. So I know I mentioned Hire Rams, their VCU Handshake. These programs have switched, and I can't remember if they both exist, but I know that Handshake absolutely has positions both internal to VCU and external to organizations that are looking to hire VCU students. And there are graduate tuition. If you are a full-time student, there are jobs out there that do offer tuition support and a stipend to be a graduate student here at VCU. All right.
And so to wrap it up, what you need to submit by November 1st, which is this for the spring application, is the application form and application fee, which is $70. Double check with Allison. Are you still waiving some of the application fees? So double check with Allison. You will need 3 references and letters of recommendation, professional and or academic. Only names and email addresses are required at the time of the application. The actual letters can come later. We need a statement of purpose and a resume stating relevant work experience. Your official transcripts, we realize, come from a little bit later from schools. It takes some time. So if you submit an unofficial transcript for us, that would be adequate. Don't forget, it's a holistic submission, holistic review, so we don't hold you to the 3.0. Official transcripts are needed, though, to fully accept you into the program, but we will start after we get 2 letters, right?
Yep.
Allison, after we get 2 letters for references, we will proceed with an interview based on that. If you have any questions, let us know. In the next slide, reach out to us. This is our information. Next slide. There you go. Of how to get a hold of us. So
yes, absolutely. I do want to reiterate too, this program is or going through the interview process, those kinds of things, I would say is a bit different than what you might experience in academic programs. We give you an innovation challenge in the interview, which is kind of fun. You can make or draw within that experience. I won't tell you what the problem is, because that's part of the surprise. But we really do take a holistic view of the students who come through this program and understand that you as a human have a unique story, and that's why we're interviewing you. We want to get to know who you are and why this stuff excites you, and you know, how you really see yourself moving forward with this. You know, you are not your GPA, you are not GRE scores, you know, those aren't even required to get into this program. But we'd like to review full transcripts so we can see the story behind what you may have experienced in your undergrad or in other master's programs. But ultimately, we want to hear from you as a human being. There are questions within the application for that statement of purpose to kind of cue you into what questions you might want to answer, or give you direction if you like. If you want to take it in a different direction, I don't see anything wrong with that either, as long as we're learning more about you as a person. But yeah, that is all we have in terms of those things today. Are there any questions from our in-person or our virtual attendees here? Bonnie, Eric?
This is Bonnie. I'm trying to wrap my head around how I would fit in here. I have always had ideas because I'm a nurse. My background's in the ED and in research. But my bachelor's is in HIM for healthcare, and my master's is an MBA in healthcare. Nice. So I don't have a BSN. So do I need to, which, you know, I've considered going back to just get that, but
no, you don't need that.
Okay.
We have people coming from all different areas: engineers, dentists, therapists, nurses.
I have a K through 12 STEM educator in this program right now, and he is fantastic.
Yeah, that's the holistic piece of it. I'm more interested, Bonnie, in hearing at the time, if you apply, is what you're interested in doing with a degree and what your ideas are. Working in the healthcare field, I'm sure you have a lot of good ideas. This is the place to vet it out, to see if it's filling a need, how do you step forward. For myself, being in the healthcare field and being the medical device stage, I was tripping over boulders trying to figure out how to get this to commercialization. So this is what this is for: networking, talking to people, being creative, thinking outside the box. If that sounds like you, Bonnie, this is for you.
Oh yeah, I can't tell you how many times I have thought of ideas and said, you know, it would be great if we had something like this, and it would, like a year or two later, would come out, and I'm like, that could have been me.
Yeah, you're the poster child. A lot of us feel that way, and most of the time we hand our ideas over to other people to bring it to fruition, because we don't know how to do it ourselves.
Right.
But actually, we're the experts in filling that need for patients. But maybe we can pass that information on to people that want to build the solutions.
Yes. Well, thank you for that. That really helps clear my brain as far as, can I even get into something like this? I know I want to do it, it's just.
Yeah, Bonnie, we can have conversations about which projects. We'll have to like kind of figure out, we can talk through some of your ideas and where your needs might be. We can direct you at the right courses that will be the most helpful for you. But ultimately, if you're, you have ideas and you keep seeing them pass you by, there are lots of opportunities. You don't even have to be an entrepreneur to make this happen. I mean, we have a group of students who partnered with, through this 590 class that I teach, that partnered with a cardiac surgeon to develop a physical product to prevent hematoma after the implantation of a pacemaker. They were a graphic designer, a biomedical engineer, and a tourism and hospitality undergrads who came into the master's program, had no idea what to do with this. They ended up forming a company with that cardiac surgeon, going to Mass Challenge Accelerator in Austin, Texas. And now they just licensed this thing out. None of them wanted to run a healthcare company. So it's just protected, it's patented, and they can license it out to others so that it can still see the light of day, be out there and helping people, but they just get to collect royalties from it and don't have to be, responsible for a full startup company, which is also kind of a happy thing for people who work so hard in healthcare, like yourself.
Indeed. Thank you for that.
Yeah, coming to this program doesn't mean you have to be an entrepreneur. Same thing for the Master of Product Innovation program. We have lots of what we call intrapreneurs, so people who are creating innovation within an organization as opposed to a startup or their own entrepreneurial venture.
And Bonnie, it's exceedingly difficult to do anything in isolation. You really do need the network that this provides you to help you move forward. We, in the healthcare field, we don't talk this stuff. So
exactly, we're always the ones saying, oh, I wish we had this.
Yeah.
Thank y'all.
Yes, you're very welcome. We look forward to hopefully seeing your application in the system.
Exactly.
All right. Eric.
Have a great day, everybody.
Yes, Eric, Bonnie, feel free to follow up with us if you have any other questions.
Right.
Certainly. Thank you all.
Yes. Have a wonderful day, everybody.
Thank you, you too.
Allison, could you stay on 1 minute?